I just want to begin firstly by explaining that given we have a continuing public health emergency, this morning I have extended the state of emergency for Victoria until 11:59 p.m. On the 16th of August, and that decision has been made acting on the advice of the Chief Health Officer, given that we continue to see rising case numbers, increasing numbers of people being hospitalised, and sadly also increasing fatalities. And today we have seen a further 20 Victorians being hospitalised and sadly a further 3 lives lost, and I want to express my condolences to each of those families as well. We are seeing increasing case numbers, and the situation is still very serious. And in recent weeks, we have been seeing a significant number of outbreaks in our aged care sector, and these are the most vulnerable people in our community. We've seen fatalities, we've seen many staff members inadvertently going to work who may not realise that they are unwell with coronavirus and putting potentially staff, colleagues, but also significantly residents in those nursing homes at risk. There has been a significant amount of work that's been undertaken in recent days with the Commonwealth Government as the government that largely funds and regulates the aged care system. And I want to take this opportunity to thank Senator Colbeck, Minister Hunt, and also my Victorian colleague, Minister Luke Donnellan, for the work that they have undertaken with me to address the concerns that we have about the risks that the aged care sector and residents in the aged care system are experiencing. So today, the Commonwealth Government, together with the Victorian Government, are announcing a significant package of measures to minimise the risk of harm, to minimise the risk of further spread of this virus in our aged care facilities. We know that we have a transient workforce, in many cases a casualised workforce working across many aged care facilities. We have seen specific instances in recent days of staff who've worked across multiple facilities, and then we've had multiple outbreaks across those facilities. So the package will involve workforce funding support. The federal government will be providing funding as the funder of this system to ensure that employers can minimise the movements of staff across facilities. This is a really important step forward in terms of reducing that risk, and most importantly to ensure that workers will not be financially disadvantaged by these changes. So there will be funding to be provided to ensure that aged care employers cover any additional entitlements to enable employees to work at a single site. As the Premier has explained, as a Victorian Government, we are already providing a hardship payment. So if an aged care worker, or in fact any worker, does not have access to leave entitlements, they can access a $1,500 payment from the Victorian Government to ensure that they can be isolated for that 14-day period because they've been either diagnosed or are a close contact. This is a really important measure to ensure that people are not having to make a difficult choice between putting food on the table for their family or turning up for work when they are unwell. Other parts of the package will also involve more infection control training that will be provided by our government to ensure that aged care facilities are well equipped and understand their obligations around infection control. There will also be further testing that will be undertaken. The Victorian Government, you'd be aware, has provided asymptomatic testing of aged care workers. The Commonwealth now is going to work with us around these issues to ensure that we can get aged care workers routinely tested for coronavirus, again just to make sure that we are locating cases, identifying cases, making sure people are isolated as quickly as possible. So the Commonwealth will deploy 5 new testing teams as part of this to test staff, but also in residential aged care facilities across Melbourne and Mitchell Shire. I've spoken about this previously, but we're grateful also to the Commonwealth in providing face masks to aged care facilities. We as a Victorian Government, of course, provide all PPE to our public health facilities, including our aged care facilities. The Commonwealth is now going to be providing face masks for staff across care facilities, not just in the hotspot areas, but making sure that staff have the PPE they need working in a vulnerable setting. So there is a very comprehensive package. I want to express gratitude to the Commonwealth for acting very quickly on my request to address these risk factors. We believe that these changes are going to be very important changes to the risks that we are seeing with those significant numbers of outbreaks and staff and residents testing positive in recent days. Finally, I just wanted to the Premier's comments. We will be making some other changes, I should say, to our health facilities. We are looking at how we can minimise the risk in all vulnerable settings. We have seen healthcare workers testing positive in our health services. We are obviously providing the top tier of PPE equipment to our healthcare services staff, and I would urge Victorians not to let perfect stand in the way of the good. I myself today am wearing a homemade mask, and I think that many Victorians will be able to make a mask like this. We have translated materials available on the DHHS website for people to make a mask themselves. So don't be stressed or anxious if you cannot get your hands on a top tier surgical mask. You can make one yourself. You can use a scarf. You can use a bandana. Something is better than nothing, and we will be making it a legal requirement from the middle of this week for you to wear a mask. But when it comes to our health services, we want to reduce the risk of people bringing in the virus into our health services, so we will be putting some additional restrictions on visitation into both our hospitals and aged care facilities. We'll be working very closely with health services to do this in a sensitive way. Obviously, there will be some exceptions there for parents looking after children, also making sure that people can still get access to carers. So carers only will have access to the ability to visit someone in hospital for 1 hour per day. We have seen health services already put some new policies in place in their health services in recent weeks due to the concerns that they have about their staff and their patients. And we want to make sure that there is not an ad hoc approach, but this is done in a uniform way so that families and patients can understand how these obligations will work in the future. So when it comes to our advice and our message to Victorians today, I just want to reiterate the Premier's message. The masks and mandating mask usage is an important additional tool that we will use to minimise the spread of this virus. It also means we need to continue to do all those other common sense things, staying at home as much as is possible, washing our hands and getting tested as soon as you have even mild symptoms.